We are in the midst of the worst flu outbreak in nearly a decade, and health officials report we haven't even reached peak yet. Already 37 children have died from the flu this season. To this point, none of those catastrophic cases here in Wisconsin, but Dr. Kristen Bencik is part of Children's Hospital of Wisconsin's Bayshore Pediatrics. She's on the front lines. This one's ugly, isn't it?
This one is really bad. It's matching what we saw in 2009 with the H1N1 outbreak.
Why is this year's flu so bad? Is it the strain? Is it the vaccine not working as well?
Right, so the
here?
vaccine's not as effective as it was in past. It's only 30 to 35% effective, which is still better than nothing. And also it's a different strain. And so it's a little bit more virulent strain than we've been seeing in the past few years. So that combination has made for a really pretty deadly flu season.
Let's talk a little bit more about the vaccine, because as we talk about its ability to match, it hasn't been great at preventing the flu, but from what I understand from a number of doctors, the difference between people who have gotten sick and have the vaccine versus those who have not is dramatic.
It is. It's amazing, and I've seen that myself in our clinic, is that the kids who had the vaccine aren't quite as sick and they're not sick as long. So even though they're saying it's only 30-35%, I would say it's higher than that just based anecdotally on what we're seeing.
How do you know that it's time to call a doctor? Because, you know, the flu is relatively common. Most people end up getting better, even necessarily without seeing a doctor, but this one seems like call a doctor sooner rather than later.
Right, and this is something where if your child's running 104, 103, 104 fever, call immediately, because this is something we can decide if we want to do Tamiflu or not do Tamiflu. We want to give you things to look for in case the child starts getting worse. So don't sit at home with this one. We want to hear from you.
Doctor, there was some news today about Tamiflu and the side effects. What are you instructing parents who might be coming in looking for that? Is this a case-by-case basis on whether or not you administer it?
Exactly. I mean, Tamiflu is the only thing we have for flu. Okay. And it does shorten the course and it can decrease severity. However, it has some side effects. It can make kids throw up, which is not very effective.
That's not great.
A very, very, very small percentage can have hallucinations too. And so that is obviously, it's a case-by-case. If you don't start it within 2 to 3 days, it's not effective anyway. So that's why we want kids to come in soon. But you need to talk with your doctor. You need to go over the side effects and decide if it's the best for your child.
How effective are the traditional things that we tell people all the time? Okay, make sure you're washing your hands, make sure to stay away from sick people. If you are sick, stay home. I mean, is that working here?
I think, unfortunately, we live in a world where we like to send our kids to school because we have to go to work. And so a lot of times, if we kept our kids home, we wouldn't keep spreading it so much.
Right.
And if you didn't go to work sick, you wouldn't spread it. So those things do help. Hand washing is still key. Make sure you wash your kids' hands before they eat. If someone's coughing, have them cough into their sleeve.
I'm trying, doctor. You know, I can't tell you how many times. Did you wash your hands? Oh, I'm like, what do we talk about? Everybody's sick.
Right, exactly.
Well, thanks so much for the advice and good luck out there. For more information on the flu or any of the topics that we cover with Children's Hospital of Wisconsin, we've got a link up set up for you on our website. It's tmj4.com. Quickly.